So good morning, good afternoon, good evening, wherever you are. Welcome to our webinar. My name is Ralf Süttorf. I'm the director of the Center for Humanitarian Action, CHA in Berlin. If you have not yet heard about us, in a nutshell, we are a new independent think tank in Berlin and Germany's first one on humanitarian affairs. We're based on an initiative by German civil society, given the rapidly expanded role of German actors in the international humanitarian arena, and of the German government as the second largest donor worldwide. Our key goal is to bring international debate to German contexts and vice versa, and to make voices, especially from the global south, heard in debates here and policy making. So our webinar, I only welcome you for today. Hopefully a prime example of what we try to achieve and to contribute to by inviting international policy experts, practitioners from the global south, and German actors like the German government to a lively, hopefully very lively and interactive debate. Of course, the topic of a global pandemic is a very inspiring one against that backdrop. With 35 degrees today in Berlin, you might wonder if the hot topic of today is rather climate change and its impact. We believe COVID-19 is a very, very interesting and very challenging topic, and that's why we are so grateful that so many of you have attended and registered on such a short notice. That's all from my side. I come back to you later on, as I will be your advocate for everything you want to contribute via the chat, but your facilitator is my colleague Darina, and she will share also all the housekeeping and the agenda. So over to you, Darina.
Thank you, Ralph, and also a very warm welcome from my side to the panel, but our participants online as well. My name is Darina Pilowska, and I'm a research fellow at the CHA, the Center for Humanitarian Action in Berlin. And I'm honored to chair the discussion today titled COVID-19 Comprehensive Response or Development Reversal. In this webinar, we aim to address the chances, but also the challenges that the international response to the COVID-19 pandemic in the Global South poses for humanitarian and also for development endeavors. Despite the Global South seems to be less hardly hit directly by the COVID-19 virus than the Global North, the South still faces distinct virus-related challenges. The density and physical layouts of many cities in the Global South render social distancing and self-quarantining extremely difficult, if not functionally impossible in certain instances. And in many countries in the Global South, most of the population shares bathrooms, living spaces, bedrooms, etc., not only with their immediate family, but also with other people outside their immediate family. Moreover, people in the cities, especially those who live in the most cramped living conditions, overwhelmingly cannot afford to stay home and not to engage in the social life, because this equals unemployment. So social distancing poses a major challenge. Apart from the urban areas, this is of course also relevant for large populations of internally displaced persons in IDP camps. Populations in rural areas additionally also suffer from a lack of resources, as they tend to be located far away from health centers and other facilities. In addition to that, many working sectors were hardly hit by the pandemic. The closure of borders has affected trade, including disruptions of the steady supply of essential foodstuffs and other essential supplies for the daily life. And the pandemic also damaged large parts of the agricultural sector. In the agriculture sector has been hit already hardly, at least in areas like Asia, Middle East, and East Africa, from other crises like one of the worst locust swarms in decades. So thus, the ongoing pandemic has created new risks for already vulnerable populations in the Global South. And this triggered a large related international response that aimed to address these challenges with various distinct COVID-19 response programs and activities. In relation to this, we at the CHA were asking us, while providing immediate COVID-related assistance, did this response actually also build upon pre-existing development structures and support pre-established development gains? Did it even push important ongoing policy agendas like the humanitarian development nexus and localization? Or is the current response rather a backlash in these regards? And I'm very happy that we have a fantastic panel today to answer these and other related questions. But before I hand over to the speakers, I wanted to give you as the audience a brief hint on the outline of today's webinar. We will start with a short initial speakers input, where each of our 4 panelists will have the chance to highlight some points that he or she think are important to consider. After that, after each input, I will pose some quick follow-up questions. And after each of the speakers has had the possibility to share his and her initial inputs, we will follow with a quick round of reactions among the panelists, after which we will enter finally into an extensive and hopefully very vivid and fruitful Q&A session, which will be chaired by Ralph, who welcomed you today. And Ralph will channel all the questions that you have posed in the chat into our discussion. So please use the chat very widely, also during the panelist speaking time. You have 2 options. Either you share your questions visible to all participants, or you send a private message to Ralph, and Ralph will then take your question up onto the panel later on. Some more housekeeping rules that I would like to share with you. You should see them on the online presentation on the screen in a moment. As well is that the session will be recorded. So if you're not one of our panelists, please keep your microphone muted and also the video turned off. This will ease our recording. If you have any technical issues, please feel encouraged to send a private chat message to the user called CHA host. This is my colleague Arvid, who will do his utmost to support you. And last but not least, we will have poll sections during this webinar, where we will ask you to share your personal views on selected topics as well. This will hopefully further encourage the interaction between you as the audience and the panel. Having said this, I would like to start immediately with one poll right away. It should appear on your screen right now, and we would like to know, which type of organization are you working for? Are you working for a government institution, a UN organization, an INGO, a national organization, or a research institute? You will have the time to answer these questions now. I will give you some more seconds. Please just click one of the boxes. All right, I think we will close in 5 seconds. Okay, so that time is up. Thank you for your participation. I think that's a bit of a screwed picture here. We have many people from INGOs joining us. Thank you. But I'm very happy that we have also some representatives from other institutions as well. I think that's very good to keep in our backups while continuing with the discussion. And because that has been so fun, we will have another poll right away. The question is, from your point of view, did the COVID-19 response undermine sustainable development approaches in favor of short-term emergency responses? And then you can click either yes, it did, or choose partly no, it did not, or I don't know. If you are not sure, you can also opt to not participate in the poll. That will be fine as well. The poll will be closed automatically. All right, another 5 seconds for you to answer. Okay. That's a very divided picture. Very interesting start of this discussion, I guess. I think that will be good also for our panelists because we will also have hopefully very diverse views here. We will start with Howard Mollett. Howard is the head of humanitarian policy at CAFORD, the Catholic Agency for Overseas Development, and he joined CAFORD in April this year. And has since then been already deployed to Syria, Jordan, and Lebanon, supporting local partner organizations on their program and partnership learning efforts, and exploring how to bring these into policy engagement with INGOs, UN, but also with donors. Howard is also an INGO signatory member of the Charter for Change Coordination Group and the Advocacy Group. Before he joined CAFORD, Howard has worked in other leading policy positions in research and in practice, dealing with gender in emergencies, local partnership, development, conflict sensitivity, governments in conflict-affected areas, and many more. So in short, Howard is our dedicated expert on global humanitarian and development strategies, and thus he is the perfect person to hit off our webinar with insights from a global INGO perspective on the COVID-19 response and its impact on global humanitarian and development policies. So welcome, Howard. The floor is yours.
Thank you, Rina. I might switch my video off just to make sure that the connection stays clear. I understand that there'll be some sort of visual. Anyway, I wanted to, if we're going to have a conversation about development impacts of COVID-19 and a humanitarian development or a humanitarian development nexus response to them, I wanted to share three kind of ideas or three kind of lenses that we might apply to think about policy funding and programming options, which are a governance lens, a resilience lens, and a localization lens. So let me explain what I mean by that. Firstly, on a governance, donor and UN policy and funding approaches that talk about humanitarian development nexus often center their efforts on or through the host government. And in the COVID-19 response, there's been a big focus on system strengthening, for example, health system strengthening. And this is often taken to mean primarily a focus on government health system strengthening. Don't get me wrong, obviously a crisis of COVID-19 scale obviously means that we need government action, and indeed the government is the primary duty bearer. But the point I want to make about this in terms of system strengthening, be that health systems or others, is that we need to adopt a more nuanced and comprehensive understanding of what that needs to look like, and also look at other actors that can support that, including civil society, the private sector, and others. And out of that then falls implications for what the German government might support and BMZ, or what German INGOs might support, or the UN and others. So to give you one example, Jordan. In Jordan, primary healthcare services are in practice delivered by the Ministry of Health operated clinics, but also private GP practices, national NGO-run clinics, UNRWA clinics, and international NGO clinics. And then secondary healthcare services likewise have a complex mix of different actors involved in support of secondary healthcare. Coordination and alignment across these is really important, of course, in general and in COVID-19. And obviously the virus itself doesn't discriminate between Jordanian citizens or other people of refugee status from different nationalities, migrant communities, and so on. But the fact is that government policy and UNHCR and sort of global donor policy and funding instruments across humanitarian and the development sectors are more complicated than that, and in some ways do discriminate. So for example, UNHCR funds on the Syrian crisis response are only there to support patients that have the appropriate UNHCR registration letter, which not all Syrian refugees have, and which refugees of other nationalities do not have access to. UNHCR funds also only permit humanitarian agencies that they support to refer patients to public hospitals, which tend to suffer from longer waiting lists, postponement of surgeries and other challenges, in contrast to private hospitals and so on. Much of this is framed by government policy on the different benefits and rights available to different categories of refugees or citizens, and of course budgetary constraints, both those that the government of Jordan faces and UNHCR, impact on the collective effort to have a given approach. So this sort of opens up a whole set of questions around how to have a successful response to COVID-19 and how to have a whole of country approach, irrespective of nationality or citizenship status, and how a Nexus approach could support that. One of CAFOD's partners in Jordan is a national NGO called Caritas Jordan. And there we've got some really good experiences of how donor support for a Nexus funding has enabled a more flexible and responsive and effective approach in the crisis. So for example, Caritas Jordan was able to mobilize from the outset of the crisis and the lockdown to sustain delivery of medicines to chronic patients through establishing a process of delivery using local pharmacies and the delivery company UPS. And in doing so, they were able to have a way of working that involved repeat prescriptions, which meant that there was the possibility to continue providing medicine to patients that would not have otherwise been possible, and was not generally the norm in Jordan in terms of use of a repeat prescriptions approach. Now this approach, both the delivery system and the use of repeat prescriptions, has also been recognised and scaled up by the Ministry of Health and UNHCR, who now also fund that approach after several months into the COVID crisis. And Caritas Jordan's ability to pilot new approaches like the repeat prescriptions approach was only possible through being able to build trust and collaboration and partnership with the Ministry of Health on primary health care, both programming and on policy reform, which was supported through multi-year Nexus funding, which they benefited from the government of Denmark. So here we have an example of where multi-year and flexible funding, and where the government of Denmark also allowed for piloting and trialing of things that may also fail and not work out, that then resulted in some good practices that have reaped benefits in the COVID response that would not otherwise have been possible through short-term emergency response funding. So what about a resilience lens on the development impacts of COVID-19? One of the major promises of the whole humanitarian development peace nexus kind of agenda has been that it will shift beyond addressing immediate causes of crises towards addressing also their immediate symptoms towards addressing their root causes. And the importance of a resilience approach to this can be well illustrated by the food security sort of second impacts of the crisis. So as Darina explained in the introduction, and as I'm sure many on the webinar will be aware, the food insecurity impacts of COVID-19 are huge and terrifying, frankly. The UN projects that the number of people facing severe food insecurity may double to 265 million or more. Already 320 million children are missing out on school meals. In South Sudan, for example, we're seeing how the lockdowns and the impacts on people's ability to work and or food production is already disproportionately impacting on the poorest and resulting in the reduction or loss of daily casual workers. this has also impacted on food availability in the markets and hyperinflation. And all of this has coincided with the onset of the hunger season in South Sudan from April to September. And then there are also big questions and concerns around how the spread of the virus and impacts of the emergency measures and wider sort of socioeconomic impacts will play out when we get to harvest season from September onwards. And what's more, despite this alarming outlook in countries like South Sudan and elsewhere, food security continues to be an underfunded sector of the global response overall, which is hugely worrying. And you know, all in terms of, for example, the food security sector under the UN's GHRP, Global Humanitarian Response Plan to COVID-19. And the WFP, FAO and others, and including partners, warn of the need for urgent anticipatory action to avoid multiple potential famines around the world. So what would a resilience approach look like? And from a kind of more transformative addressing root causes of the crisis perspective, what I would like to sort of put in the center of sort of responding to that question is the need to look at support to subsistence and small scale, subsistence farmers and small scale food producers. Now, obviously, urgent absorptive and adaptive action is needed to support them to continue to be able to work safely and effectively, also in the context of wider emergency measures. And that might include looking at how to, for example, support them in the context of lockdowns and border closures, for example, through designating small-scale food producers and suppliers as key workers, provide protective and hygienic items, or supporting safe and affordable means of getting food products to market so that they can reach local consumers. But also, if we take a longer term perspective and think about building back better, then we also need to think about how donors like Germany can do more to support resilient and environmentally sustainable approaches to agriculture, both in the crisis response and longer term in the recovery context. It's well established that COVID-19 is what's called a zoonotic disease, passed from animals to humans, and that zoonotic diseases are more likely to spread as a consequence of environmental destruction, habitat loss, deforestation, and so on. So to address this, as well as to promote the resilience of the worst affected subsistence farmers, small food producers, and so on, CAFOD, the FAO, and a range of our partners across Africa and other regions point to the importance of a paradigm shift away from industrial and export-led agriculture to a diversified agroecology approach to food systems. Agroecology builds resilience by combining different plants and animals and uses natural synergies, not synthetic chemicals, to regenerate soils, fertilize crops, and fight pests. It's less dependent on costly imported inputs, which can increase vulnerability in the context of trade disruption and price shocks of the sorts that we've seen happen as a consequence of COVID-19. And it puts a central emphasis on food producers and consumers rather than on large-scale agribusiness and global trade interests. Yet this is not the current dominant orthodoxy, and we think it should be. At the moment, much more influential has been initiatives like AGRA, the Alliance for Green Revolution in Africa, which has been pushing the use of chemicals and hybrid seeds in Africa since 2006, for example. But recent studies have shown how this approach has not worked, has had harmful impacts in terms of the resilience of small and subsistence farmers. And that is now being felt, the consequences of that are now being felt in the COVID-19 crisis. So the German government and others want to think about a transformative approach to food security, but both in the response and recovery. Then agroecology needs to be front and center. And as we think towards next year, the UN Global Summit on Food Systems that the UN Secretary General Antonio Guterres has said he will convene, then it will be important to think about how can we bring these kinds of greener and resilient agroecology approaches both into the response and into the recovery. Third and last, very quickly, I want to just flag the localization lens. Everyone has recognized that local actors will have a central role to play in the COVID-19 response. Both donor and UN policy frameworks on the humanitarian development nexus often talk about being people-centered and engaging local actors. But in practice, global and country-level nexus processes tend to be very UN system-centric and national government-centric. And engagement with national local civil society from the affected communities is often left something of an afterthought. You know, there's really shocking statistics as recently as July from the Center for Global Development, which suggests that just 0.07% of the global funds from institutional donors channeled through the UN have reached local or national NGOs so far. We should all be appalled by that. It's a shocking failure. So how might we, moving forward, look to both better support local and national NGOs in the response, and also build that localization perspective into building back better, so that we're better ready to support the national and local NGOs on the front line of this pandemic or a future crises. I'd suggest 3 priorities on this for a bilateral donor government like Germany. Firstly, donors need to increase support for country-level, locally led consortia, platforms, and funding instruments that involve ship by national or local civil society. These do exist in some contexts. For example, there is the START Fund, which is a global network setting up country-level, locally led hubs to disperse funding, where local civil society is involved in collaborative needs assessment, prioritization, and timely disbursement of funding within, within a matter of days. Whereas we know that within the UN system, it takes months for funding to reach the front line, and then, as the statistics I highlighted are telling us, it's not reaching the local NGOs. Secondly, bilateral donors need to hold their international intermediary agencies they fund, the UN agencies and NGOs, accountable for how they cascade the funding down in an effective way and responsibly partnering with national and local NGOs. 2 basic metrics that BMZ or other German governments could adopt on this could be to always require UN agencies or NGOs to systematically give an equal or a higher level of overheads cost coverage to their local NGO partners that they take themselves, and also that they systematically track and report on the level of funding to local NGOs. Because unless we do this, local NGOs will not have the funds to work safely if they don't have that overhead costs supported. And there's so many complex and new risks faced both in COVID-19 and in other crisis responses that it's, frankly unethical if we're not providing national NGOs with support to their overhead costs. And also, we're never going to know if we're supporting localization effectively if we don't effectively track the funding. And so then third and last, we've seen autocratic governments and non-state armed groups using COVID-19 to harass and obstruct and sometimes perpetrate violence against local civil society. So donors like Germany, could you be looking at how they use their leverage with governments to have a dialogue and attach guarantees on protecting the space for civil society and the protection of aid workers? And on that, again, from a Nexus perspective, much more thought needs to go into how to connect across the humanitarian accountability to affected populations, systems and approaches, and then the more developmental sort of social accountability approaches to supporting a dialogue between citizens and government and holding government to account. So governance, resilience and localization. I hope these have been some helpful ideas for the discussion. Thank you.
Thank you, Howard. That was already a very extensive and detailed and rich first input. Many thanks for that, for the global INGO perspective. I really appreciated your focus on the interrelation between the food sector and the COVID-19 response, and also the hands-on recommendations when it comes to localization. I hope we can jump on these issues again in the discussion. But in the wake of time, I would now quickly jump over to Somalia and introduce our speaker, Abukar Samo Mohamed, to you. Because now that we have heard the global perspective, it will be interesting to look into a specific operational context specifically. In this regard, there couldn't be any better example than the case of Somalia, a country which has been on the front line of the humanitarian development nexus implementation. So let's hear how the COVID-19 response shaped the humanitarian and development policies and practices in Somalia from Abukar. Quickly, some short background info on Sabuka. He is a Master of Business Administration in Healthcare Management, and he's a health and nutrition specialist with over 9 years of experience working in both humanitarian and development settings, working with both local and international organizations. So he has a very strong background in designing and managing health and nutrition projects. So here we have the interrelation between health and nutrition as well. Currently, he is the health and nutrition manager of Wardi, a local NGO operating in Somalia. And among others, he is involved in supporting the Ministry of Health in Somalia with the ongoing strengthening and restructuring of the Somalian health system after decades of its near collapse. Abukar, the floor is yours.
Thank you so much, Dorina, for the introduction. So I'll briefly provide a perspective to the current situation in Somalia in regards to the COVID pandemic, as well as years of challenges in terms of development. So with COVID, the country reported the first case of COVID in March 16th, and until now, there are about 93 deaths that were reported across the country. We are seeing the numbers reducing over time, and there were no deaths reported from June this year. So the situation is a little bit improving, but the COVID situation came at a point when the country was already dealing with several other emergencies driven by conflict and disasters, and protracted and sacred disasters that have been in Somalia for decades now. There existed a huge humanitarian needs of about 5.2 million needing support. And although 2.2 million people were reached with food support by May 2020, the food security cluster estimates about 3.4 million people that will need humanitarian assistance through July through September 2020. Now, that said, what has been the impact of COVID-19 in Somalia? It has already exacerbated existing issues like hunger and lack of access to food. Basically, this is as a result of restriction of movement, huge reduction in remittances. The country actually relies a lot on remittances from huge diaspora population. For women and children with and persons with disabilities, we are seeing heightened protection issues. We have also seen shifts of focus from recovery and development efforts, and actors focusing more on responding to COVID-19. For instance, we've had before the COVID-19, there were discussions led by World Bank around financing, providing financing facilities that will support the health sector for Somalia. And discussions around these have somehow delayed or have not started as a result of the people now focusing more on responding to the COVID-19. So we also see a decline in utilization of key maternal and child health services. For instance, we've seen drop in immunization by up to 17% when you compare these with similar time in 2019. And basically, this is driven by both supply and demand side of healthcare. And on the supply side, we are seeing disruption in essential delivery of essential health services as well as other commodities for healthcare. We see limited funding available for healthcare, especially in response to the emergencies. The health cluster required about 47 million, and they so far received up to 20%, only 20% of this. So there's a huge funding gap for the healthcare generally in Somalia. And the capacity of the few existing health facilities seems to be overstretched by increased demand by COVID-19. And on the demand side, due to the movement in restrictions as well as loss of income, people are not able to go to health facilities and seek services for themselves and even for their loved ones. This is complicated by the fact that most of the people are now concerned about getting the infection from health facilities, and these health facilities are poorly serviced, so you will expect high level of reduction in infection prevention control measures here. And we've also seen the health cluster has also reported closure in health facilities, some of the health facilities, and this is basically due to funding limitations. That reduces the capacity of the government as well as the actors to effectively respond to the pandemic. So what are the risks that are related to all these that we have just said? So we are seeing this might negate gains made towards reconstruction and recovery in the country, and we are seeing the risk is that we are seeing unconducive political environment, especially the current upcoming elections might also worsen situation in the country, reducing access for partners working for organizations working in the country. We might also realize worsening humanitarian rights and protection issues for women and girls during this COVID-19 pandemic. UNHCR has already reported a rise in GBV and other protection-related issues for women and people with disabilities in the country. And before I finalize, what does this portend for the Nexus in Somalia? So we are seeing that some of the efforts already made by the actors in the country in terms of building structures somehow being affected by the COVID-19, as funds now are channeled towards providing immediate support to in response to the COVID-19. We also see in the national systems at the government level somehow overwhelmed by the pandemic, and in terms of the opportunities that are currently available or we can draw from this current existing situation, is that there are some local solutions that have emerged as a result of the COVID-19. The UN and the government have somehow been able to build an emergency response system, and this can be strengthened in the long term so that we can have a more sustainable and forward-looking system in place. And I think that is all I can say for now. Thank you so much. Thanks for listening.
Thank you, Abuka. Very enlightening, especially also how the different response areas were interrelating in Somalia and how the Nexus came in here. I hope we have time to especially tackle the issue of the Nexus in Somalia later on in the discussion, also with our fellow panelist Henriette Sachse from the BMZ. But looking at the time, let's proceed to another interesting context, the context of Pakistan. We have now been discussing a very fragile area, the area of Somalia, and I would now take the opportunity to turn into a more political stable environment and see how COVID-19 impacted the situation there. From Pakistan, Ali Zaidi is joining us today. He is a development consultant with over 8 years of experience and a special focus in child protection, partnerships, localization, and participation. He has worked with several German NGOs, but as well as with UN organizations and local organizations. And in addition to that, he is a PhD student at the IE at the University of Bochum in Germany, where he is doing research on negotiating development, a trans-sequential ethnography of development in Pakistan, where he examines the role of local NGOs in the process of mediation between a German donor and local beneficiaries. Ali, may I hand over to you?
Yeah, thank you, Darina, for a generous introduction. And it was great to hear from my co-panelists. It was very profound talk from them. Talking about COVID impact in or on Pakistan, I would say it's not different than as it happened on other countries. And the thing is, but in combination of existing or let's say coming catastrophes, it worsened the situation. For instance, like locust attack on crops, especially wheat crop, it covered like 200,000 hectares in the country. And then there is a forecast that there will be a famine. Government is already facing some difficulties in terms of food security issues. But then, okay, like there are so many like issues it hit, like unemployment and economic issues. But coming towards like development, I would say practicalities, development initiatives, this pandemic put the development activities on hold. Either partners had to engage with the response activities, humanitarian, or suspend their development activities. Actually, I would say for me, the biggest suspension I had observed, and still I think it's quite relevant, it was in education sector. But then like this suspension, in a way, it led to different dimensions. In a way, it contributed to shrink the space for the civil society. Imagine Pakistan is a country where there are existing laws and regulations which are controlling NGOs and tightening the situation. In particular for the NGOs. So over there, the most of the, let's say, this COVID response was rigged via government and by the multilateral as well as bilateral donors. So that's how like there was this existing space for the civil society was, I would say, a bit compromised and compressed in that way. Concerning the, but there were there were local partners who were already engaged in development activities and then who later engaged after COVID hit into COVID response. But then this response was very much dependent on the willingness of their back donor or their INGO who was supporting them. So and then there are, I would say, there were some trends which had been noticed. The INGOs who were having their back donors, who were more in bureaucratic environment, who were having more bureaucratic environment and lacking institutional capacity, the response of their local partners on ground in Pakistan, that was relatively slow, I would say quite slow in that way, towards COVID-19 assistance projects or activities. However, the INGOs who are having their own resources, their own funds, they were more swift in Corona response. So they quickly, they gave go-ahead green light to their partners to get engaged. But I would say, and also initially when COVID hit, the NGOs, I would say the cost for the suspended project activities, that was initially reappropriated, and later their partner, their INGOs, their back donors, they topped it up. But initially it was the cost of the suspended activities which were reappropriated to give the response for COVID-19. And then I would say there was also a big issue which is equally true for the local NGOs, and I would say for INGOs, and particularly German NGOs here in Germany. It was of fundraising, and it's I think it goes hand it's again equally true for secular NGOs as well as faith-based NGOs. For instance, Catholic NGOs, some of them they raise their funds during Lenten campaign, during this Easter time. So what happens, like Lenten campaign was in between this Corona episode, so they couldn't raise much of the funds. That's okay. On one hand, like it's true that there were like BMZ or some other partners, they increased the funds. But then just imagine, like about the matching grant they had to raise. So there were, I think I would say, less means to raise that amount on the other hand. And considering, or let's say discussing about Muslim NGOs, they raise funds usually during Eid time or Ramadan time for zakat and other. So the issue over there was that these two events, like these two Eids, they were also in between this Corona period. So there were not much activity concerning fundraising was going on. Okay, and now I would say secular NGOs and faith-based NGOs, that there is a problem. Like, okay, both faced equally the problem. I would say in a together. The physical spaces to generate these or to raise these funds, those were vanished, or I would say, let's say, compromised in a way, because for instance, like mosques were closed, then churches were closed, not much space available for the fundraiser on the railway station or during Corona and social distancing period or lockdown situation. Then universities were closed. It's also for the local NGOs who were raising funds locally from the different institutions. But I would say this situation also brought new categories into limelight, and to somehow these new categories are linked to localization issue, but I would say also like trans-localization issue, because during this during this period, so many local philanthropy activities or initiatives have been noticed, and still like they are popping up. But there are certain, I would say, issues regarding this local philanthropy. They are individual, they are informal, they are unorganized, and they are uncoordinated. Because in these small stories, one could see that the SOPs for the social distancing in Corona situation, they were compromised. There was no formal record like how much they had spent on that. Then the item people received, there were duplication, and then people were selling them for luxury items. So it's either in one can also see different YouTube videos like how they are doing, and also reports how it happened. But also I would say the translocal diaspora, Pakistani diaspora, they also took a lead. I would say contrary to the Somalian case, the workers' remittances they increased a lot. lot. I would say even it's history high in Pakistan during the second quarter of the year and in July. So there are 3-4 interpretations of it, and one of them is it's like the diaspora who is living abroad, they send it to their family members in Pakistan. That's one interpretation, but then it's a bit contested one, but it's one interpretation of it. And coming to, I would say, conclusion. Right now, this is the point of time when we get an opportunity to think about development and humanitarian activities again. I think for me, it's the whole episode brought to consider, reconsider and revisit the vulnerabilities. Those should be redefined. Marginalization should be redefined, so as the risk. For instance, like initially it was thought that humanitarian actors, or let's say staff, they're more at risk, but now I think development staff or field workers, they are equally at risk. So the same goes for their target audience, their target people. So I would say it should be redefined, and perhaps it's a bit naive, but then there should be a combination of development and humanitarian approach. Could be a kind of a developmentarian approach. So I don't know, like it's one can debate on it, but there should be something like that. Thank you, Darina.
Thank you, Ali. Another very interesting perspective. Me personally, I really appreciated how you connected the pandemic situation of the global north with church services being postponed or cancelled with the situation in the south, which means that then funding coming from faith-based organizations is limited. So thank you for that very, very interesting view, because I think that also should interfere with the funding that is available from faith-based organizations when they are applying for institutional funds, for example, from the BMZ. So I think that is a perfect possibility for me to introduce our last speaker, who is Henriette Sachse from the BMZ, the Federal Ministry of Economic Cooperation and Development here in Germany. Now that we've heard INGO perspectives and views from the ground in Somalia and Pakistan, I think it's more than time to also introduce a donor perspective. So welcome, Henriette. Henriette is the Senior Policy Advisor at the Division for Transitional Development Assistance at the BMZ. She joined the BMZ in 2008, first in the Middle East Division and the Division for Economic Cooperation. But her current focus areas are policy and implementation of the Nexus and cooperation with NGOs. Henriette, may I hand over to you?
Well, thanks a lot. And thanks also to the other speakers. It's been very interesting to listen, and it's very great to have the opportunity to speak today, and also to get insights from the fields, from Somalia, from Pakistan. Thanks so much. Well, it was said we have 5 minutes to kind of give a picture about what has the BMZ been doing the last couple of months. So I try to be brief, and then we have more time maybe for the discussion, and then we can get into detailed questions. So what was our response? I mean, on the one hand, we tried to put up a very fast response, obviously, and we had a lot of flexibility regarding our programs, our funding, our programming, basically, and we talked to all of our partners, which of course are multilateral organizations, UNICEF, the World Food Programme, UNDP, and so on. We had a lot of discussions with NGOs, INGOs, and also our other partners like GIZ and KfW, in order to see what can be done during like ongoing projects, what can be redirect, what can be reprogrammed. we also redirected a lot of funds in this year. We redirected more than 1 billion euros and tried to basically focus this money for COVID-19 prevention. Preventing or slow down or mitigating even COVID-19 effects. So, for example, from our TDA division, Transitional Development Assistance alone, we redirected 65 million euros for health infrastructure in Yemen and in Iraq. So, and those funds were not directed into new projects, but most of the time we could top up or basically reprogram existing programs. And in that way, of course, we could react very, very quickly and very fast. On a long-term response, of course, we received and we advocated for additional funds. And we are very happy that we received, in this year, we received 1.5 billion extra euros, extra money. And also for the next year, we can plan with additional 1.5 billion euro. And this money will go specifically, to mitigate and to absorb the middle and long-term effects of the COVID-19 crisis. So we decided to focus our development programs for certain areas. Social protection, of course, it's very important, and that's not only social protection systems on a governmental level, but of course also on regional and on community levels. Food security was mentioned before. It's a very important field of intervention for TDA, but also for the BMZ as in general. We also want to put more money and stress and strengthen our programs in terms of disaster risk management, which is also preventing and put up emergency plans and systems. Health, of course, I mean, we mentioned that, but health infrastructure is of course key at the moment. We of course put more money into the GFATM and in Gavi. We strengthened the WHO. So of course, this is also to mitigate those effects. I mean, we've been discussing, or it's been said, child security and child mortality rates are probably going up because of missing health infrastructure. So this is what we try to do in terms of strengthening health infrastructure. And of course, additional support we want to put up for enterprises, for specific industries. I mean, textile industries is key in a lot of countries, Bangladesh, but also Pakistan was mentioned, and to secure jobs and to secure key industries. That's also very important to us. What is good that we have, we have instruments in place, like the Transitional Development Assistance, but also our special initiatives, for example, for displacement. So we can react very fast, and we can, on the other hand, but also plan for the next couple of years, because those instruments, those crisis instruments, they are multi-year funded. So we have a multi-sectoral approach. So the COVID-19 crisis is nothing new for us in terms of a crisis situation. Of course, it often adds to ongoing crisis in a lot of countries, which makes it even worse, of course. But and it's a global crisis, which of course the dimension is extreme, and that is very new. But we also learned from the Ebola crisis a couple of years ago, and so in terms of our instruments that we have, I think we are well prepared, and we have you know, the money now to have a fast response, but also to build up a longer term response in the coming years. Stressing the nexus is of course very important in this situation, and I'm very happy that we can discuss it here. I mean, from a point of the German government, of course, we work very closely together with the Foreign Office, and they also had their finances increased for COVID-19. So we work closely together and see how we can cooperate very closely, how we can plan our funds together so that we have a maximum effect on the ground. But I see the Nexus, I think the HDP Nexus, I mean, we've been discussing the HDP Nexus during the last couple of years, and there's been a lot of thoughts put into concepts and so on. But I think this crisis will see whether we actually have the key components ready so that the Nexus can actually be implemented and be useful on the ground. So, and in that way, it's very helpful to learn from colleagues from that work in the field, because it's important that on the ground those different organizations and partners work closely together and see what is needed. And in that way, of course, the local voices, the local NGOs are very important. And for us at the BMZ, it's key that we work with local NGOs through our German NGOs. They always have local partners. They always you know, get the local perspective. And that is also very important for us to see what is needed and how we can interact on the ground. And especially with the transitional development assistance, we focus not so much on the cooperation with the governments, but rather with the communities and the most vulnerable people. We actually just launched our new strategy. So if anyone is more interested and gets more details on the BMZ website, Transitional Development Assistance, you find our strategy. You also find a new brochure with different pieces of work in different countries. So this is just like a side comment. So maybe just to close, I don't see, of course, I mean, we will see a lot of shocks and effects, negative effects on development achievements that has been, you know, so far in the last couple of years. But from our perspective, I don't see that there is a shift in reprogramming towards short-term program or responses. But on the other hand, I see that we have long-term commitments in our countries that we are willing to follow through. We have the crisis instruments in place, and of course now we have more money to actually deal with the problems. I'm not sure whether the money alone, of course, will help. It's a very good pillar. It's very important, but I think it's we will see and we will learn together how the situation of COVID is developing in the next couple of months, what the lasting effects actually will be, and then I think together we have to see how we can tackle those challenges. Thanks.
Thank you, Henriette. Again, very interesting remarks, and I think also lots of food for further discussion. Also among you as a panelists, I would hit off this discussion between you as a panelists with the example of Somalia, which is of course one of the on the front lines of the Nexus implementation. And I wonder if you, Henriette, could just elaborate a bit more on how this closer cooperation between the Foreign Ministry and the BMZ actually worked out with the help of this example in Somalia. And maybe Abubakar can also share his point of view after that.
Yeah, well, I'll be short maybe, so that we, have also time to dig into other issues. But yeah, Somalia has been a very interesting case for us because we decided 3 years ago that we're going to have Somalia as a Nexus pilot country for the German government, so that the Foreign Office and the BMZ will work closely together. We had a mapping made so that we actually see what is doing who and where and so on. And then we decided to put up a few so-called pilot projects that we from the scratch built up together. And one, for example, is Save the Children. With Save the Children, we put up a program that was designed as a Nexus pilot program. And it was really interesting. I mean, the thing is, we also had to learn, of course, how to actually program and how to analyze and how to put up programs that are really interlinked. And so we are very glad that we have a lot of dual mandated NGOs that can have both the perspective of a humanitarian actor and of a development actor. So in a sense, it was also for us a process, and it was a good process to learn and to see and to get different ideas on how to actually put up a program. And maybe another idea, we also in terms of the Nexus, we work very closely with WFP, UNICEF, and FAO in the Somalia context, and we put up a joint program in South Central Somalia. Enhancing food and nutrition security. It's a multi-sectoral approach, and in that's also very interesting for us in the process, but also in the content-wise, because we bring together different UN organizations. They are dual mandated, but often they are not really used to work very closely together and really cooperate and coordinate and have that Nexus idea. So we pushed them, we discussed with them what we expect. And I think that's also, it was a very good learning curve and very learning process for us. But I think also, and that's also the response we get from the UN organizations. So I think maybe just, maybe I stop there. That's basically just an idea more on the process. But I think it's also very important to learn from each other to see how to put up things, how to operationalize the Nexus. Thanks.
Yes, thank you. I will give all of our panelists the opportunity to react to not only what Henriette just said, but also to the points that other of your panelists may have raised. But before we do that, I would quickly also mention our chat again, where all of our audience and listeners can participate and can post their questions for the Q&A session, which will follow shortly. So if you have not already posted your questions, please do so. Ralph will host the Q&A session after a very, very quick round of reactions among the panelists.
Arina, sorry to jump in, if you don't mind. We have only 20 minutes left, so I take the liberty maybe to raise 1 or 2 topics already from the chat, so we make sure the audience can speak up as well.
Interesting, yeah.
Because in 20 minutes we need to close, unfortunately. There are 2 key points raised in the chat, and maybe that's something we can already pass to the panelists for their reactions, and all of them are linked to what has been said before, so I think that might make sense. One topic is the shrinking space, which has been mentioned, and this is surely also much linked to the localization issue, which has been for good reasons debated. So a couple of attendees raised the issue that pushing for a more localized response would make a lot of sense, but on the other hand, there has been the issue of human rights clampdown, of space shrinking for local actors. So maybe Ali and Abuka could elaborate a bit on the example of the country case studies, how this is mirrored in your regions. While it could be a very interesting question, maybe also for Howard, how to deal with this tension, which is an overarching question. On the one hand, we want to have a much more localized response. On the other hand, we see globally that the space for local actors is shrinking, and they have often limited leverage to fight this. So how do we deal with this tension, and do we need to face limitations in this regard? And maybe very quickly, only one other point. On the Nexus again, Henrietta has mentioned already efforts on the BMZ side. How could it be encouraged in a much better way? A couple of colleagues asked, raising the issue that in theory it makes a lot of sense, but in practice in many countries we know that's not really materializing. With that, back to you, Darina.
Thank you for these inputs. And I think just in the wake of time, maybe you can keep these questions in mind when I give you the floor for quick reactions to your fellow panelists, but also to these first two questions from the chat. So very briefly, with a look on the clock, Howard, do you want to react?
On the issue of civil society space and the sort of human rights consequences of COVID-19, absolutely agree that's a priority. I think that's where the silo, and one question is what political diplomatic leverage donors like Germany have and could use. And so in priority context, like we've heard from Henrietta, that Somalia is a priority context, and obviously these are sensitive issues, so it might not be possible to talk in public webinars about all of this, but it would be interesting to hear any reflections from Henrietta, if she's able to, on how Germany is able to work across aid programs and diplomacy to support that. And I just also wanted to highlight a point I saw in the chat box from National NGO representative Wintun Key from Myanmar, suggesting, expressing interest in that HDP Nexus pilot with INGOs. And so a question also follow up to Henrietta, to how was that pilot articulating the role of local partners in it? Were they able to be a part of co-designing, or could there be future Nexus piloting processes that emphasize local leadership? There's amazing work by national NGOs in Myanmar that I'm aware of that bridges the Nexus, and because they're embedded in communities, they see things not in our international silos, but in the more holistic way that communities see things. So could BMZ imagine funding a locally led national NGO pilot on Nexus, and what could that look like? Thank you.
Well, maybe I just answer quickly to the last question. Well, the thing is, we don't finance directly local NGOs. So it's always an NGO registered in Germany necessary. Basically, that's at least the BMZ policy. I think the Foreign Office, on humanitarian funding, they work differently, and they often also fund localized funds in the countries, and then local NGOs can apply directly. But so we work with German or NGOs basically, but then they always have local partners, and also in the design of Nexus programs. And I mean, I mentioned Somalia because that was our first pilot basically, but in the meantime we've been working with different in different countries with NGOs and bringing up Nexus programs. So they're both they're basically financed by the Foreign Office. There's a humanitarian track financed by the Foreign Office, and basically there's a track, a development track financed by BMZ, and we have a collective outcome defined. So both tracks actually support that collective outcome. And for all those projects, there's always, and programs, there are always local NGOs involved. So, I mean, it's my understanding that they were involved also in the design of the Nexus, because of most of the German NGOs, also INGOs, they don't work, they have offices, but they always work directly with local NGOs. So they take those knowledge and these the experiences in the project design. I mean, that is my understanding, but we are happy to also, you know, get ideas on how to maybe have an extra pilot with local NGOs. But so we'll see how that goes. Yeah.
Hello, if I just jump in, sorry. From our experience, we are currently working with a German NGO called Action Video. And they are funded through BMZ, and we have several long-term developmental projects with them in South Central Somalia. And these projects have actually been quite helpful in sustaining food security for families, especially during this COVID-19. And on top of this, we have been able to source additional funds to support these families in terms of providing healthcare services and creating information around COVID-19, which was quite low initially. But when it comes to the Nexus, we have very little knowledge on its implementation. I think we were involved in a project that was funded, I think, by BMZ, but through KfW. That was in South Central Somalia, and most of the times the money comes through the UN, and by the time the local agencies receive the support, you will realize that the project might have already been somehow distorted, and you don't have a clear picture of what the initial intention of the donor was when the project was given. So basically, we may not have achieved entirely what was, we are not entirely sure, but somehow the project was said to be somehow developmental, but it had the look of an emergency project in terms of how it was implemented, as well as the structures that were supported in terms from the government as well as the UN. And basically, when you have access to these funds through a German organization, for instance, I think it is easier because most of the planning is done with the local organizations, and the information that informs the project is upside from down up. But when you have this other complex, for instance, the UN bodies, by the time the project reaches the local grassroots or local organizations, so much has already changed, and essentially the impact will be much less. Yeah, I don't know if that makes sense. Thank you so much.
Thank you, Abukar. And I would directly like to involve Ali, because you have already mentioned in your initial input that there was different levels of flexibility in the COVID-19 response, depending on whether an INGO worked through back donors like BMZ, I suppose, then as opposed to INGOs channeling their own funds to local NGOs. So I wonder if you want to comment on that, or have any other
Yeah, actually, I was already thinking to shoot a question for Henriette, but then I think first I would touch the issue of this shrinking space. I think it's not new to Pakistan when the crackdown or tough situation comes for the civil society. It happened earlier, especially it used to start during all these martial law period or whenever dictator comes. So, but in that case, I would say we have a precedent that during Kerry Lugar Bill and Coalition Support Fund, they made sure that a certain chunk of funding will be dispersed, or let's say for the development initiative, that will be rolled out via civil society. So it gave some breathing space. If I could a little criticize, for instance, like DFID, they're mainly going via government channels, like they are giving the funds. Pakistan is the second top, let's say, the funded country by the UK. But then in that way, like it's mainly via government channels. It's coming. So it could be like, okay, a pressure from the developed world, which is providing the funds to the global south, I would say, that they can also make a prerequisition that it should be disbursed via local partners. So that's how one can think about having some playground for the civil society. Okay, but the question regarding this issue about, I was thinking because for instance, like the INGOs who are having back donors like BMZ, I think it bounced through the matching grant, like 20%, 25% has to be raised via these INGOs. But right now there are issues that they cannot raise that amount. So I was just wondering, like, if there is any consideration, or there is they are aware of that, the fact that their BMZ's partner cannot raise that amount, and they are facing troubles. And I think it's kind of a trickle-down effect. It goes to the local level, because then local partners also struggle to get funds for certain, I would say, development activities, you know, as well as humanitarian. So yeah, I hope, yeah, if Henrietta could answer it, I'll be grateful.
Sorry, I think I didn't really get the question, but the question was the question the funding, and you need to add extra funding from the local side, and
Yes.
It's not possible. Okay, the good news is for TDA, the Transitional Development Assistance, that's not the case. So we have full 100% funding from in the field country. So there's no extra money that the NGOs need to bring in themselves. This is, but this is special. We have other in the BMZ. We have other funding mechanisms for NGOs, and for them, yes, that's right. You need at least 10% to bring in on your own. That's the German. That's at least the German NGO. They have to bring in 10% or so. That's also applies for humanitarian money from the Foreign Office in most cases. So I see their point. That's very difficult. We also have discussed that with our Ministry for Finance, because there's a lot of regulations behind it, why it's so, and why we have the exception at the moment. We hope to stay. I mean, for the TDA at least, we hope that we can manage also to have that 100% funding in the future. But we see the problem. Yes.
All right, thank you for that. I think because of our time running very quickly, maybe one last round of inputs from the chat. Ralph?
Many thanks, Darina. Maybe for the closing round, I can just feed in 1-2 questions you might address in your final words, if that's okay. One topic which has come up, for example, from ICRC, which is closely linked also, I think, to the local actors' involvement issue, is to which extent is COVID-19 response also a case where we see dealing with new actors and totally different actors than the humanitarian machinery usually deals with? For example, the affected people themselves, who are very often implementers themselves. So is this an opportunity to work and focus much more on the affected people who provide a large extent of the response in all crises, as we all know? One question you might be happy to address. And a direct question again to Henrietta from BMZ, if you don't mind. One is on the sectors funded. Dorothea would like to ask which priority education should have, as we heard about education crisis in many countries. And again, the question, if not direct applications for funding for local actors, would be at least a future scenario which the German government might look into, given that I can add that indeed on the humanitarian side, German Foreign Office is working the same way, that only in Germany based NGOs and actors can apply. With that, back to Darina, and I close my role here.
Thank you, Ralph. Very interesting questions. Anybody of you who wants to go first? This is the very last opportunity for you to share some remarks, and maybe if you like, also answer to that very interesting questions from the chat. So if I may, maybe Howard, you can start.
I'm happy to leap in, give my colleagues a bit more time to think about what they want to flag. Just to pick up on a couple of points. On Marcus's question about non-traditional, actors that have been involved in the response, community participation themselves, volunteers, or other kind of, not just humanitarian agencies. I think this is so important. And in theory, a Nexus approach, which is trying to sort of think beyond the kind of sector boxes or the more traditional rigid humanitarian box, should in principle support that. But I think one of the challenges is that the vast majority of the funding, because of the scale of the crisis, has rightly, or it's important that the funding's gone to the UN, and the UN system and UN agencies are not set up to work with non-traditional actors. The vast majority of the funding has gone to their pre-existing partners, to the extent that it's gone to people as opposed to UN agencies adapting their programming, and not therefore to the sort of non-traditional ones. So particularly local faith-based groups, which are often the ones that have stayed with communities when, we've obviously heard international agencies. I heard someone from Save the Children say as early as in March that 30% of their international staff had either withdrawn or been relocated from field locations because of COVID-19 as a rare, and because of the restrictions on movement and access within and across borders. So it's local actors and it's non-traditional actors like faith groups, like the volunteer networks and communities that have stayed there. But the UN system and the traditional humanitarian system is not well set up to get funding to support their work. And then on the, just on the flexibility and localization issue, it's just really encouraging to hear from you, Henrietta, how these have been priorities for BMZ, and it's really interesting to reflect on what has been new in flexibility that BMZ's been able to extend, and or what challenges have you faced in extending that flexibility. I was involved in an interagency standing committee process with NGOs and UN agencies to come up with a set of key commitments on funding flexibility amongst INGOs and UN agencies to enable flexible response to the COVID crisis. And a number of the UN agencies who, as we know, have received most of the funding, did point to how they were trying, it was a kind of unprecedented process that every week there was a stocktake call at the global level with the heads of partnership in UN agencies and NGOs reporting on how they were making progress or not in extending new forms of flexibility to their implementing partners. And whilst there may have been some institutional inertia in some of the UN agencies, that's true, and some did better than others. So UNHCR and UNICEF took steps that some other UN agencies were not able to take, and it was not entirely clear the other UN agencies were not able to be as flexible or to report on the pass-through on funding. But they did sort of point to their back donors, their institutional donors, and Germany, not specifically BMZ, but Germany was mentioned as one of the things that did have a lot of questions about flexibility, and all that there were therefore delays in or wanting to check on a country by country basis to determine if flexibility could be extended to the humanitarian and the wider response. So that, I should say that it wasn't only Germany, it was other and I think it may have been other parts of the German government, not BMZ, but and other donors were mentioned as well. So it's obviously been a learning process for donors, for UN agencies, for NGO, and for local actors. So, you know, reflecting on that and thinking about what would be a moment to draw the lessons from the new forms of flexibility that were extended and how to make them the norm in future. Thank you.
Thank you, Howard. Henrietta, do you would directly want to respond?
Yeah, well, maybe just a few thoughts on flexibility. Of course, I mean we've got a few restrictions also from our budgetary framework that we work with in Germany. So it's for us also challenging to give more flexibility, but we do. So we, especially with our NGOs, they have almost 30% of their funding that we provide for them. They can flexibly shift to other sectors, or in case of a crisis, they can redirect their activities and so on. And that's without our saying or without our extra permission. So they have a wide range of flexibility themselves that they can use, and we encourage them to do so. And also we had other elements of like processes and reprogramming that we could offer. For the UN system, of course, it's a little bit more challenging as well, but also there we've got a lot of flexibility that is, that's possible. So I think, lessons learned after a couple of more months, that's really important, and that's what we, I think, always do in the board meetings, being at UNICEF or other board meetings. I mean, there are a lot of discussions about how the system should work and should work better, and what is needed from the donors, and we are happy to learn in that respect as well. Maybe just a few last thoughts. I think it was really good. I would have liked to listen to more field voices, but it's been good, and I take a few things with me, especially like the idea of having a stronger impact from the local communities, how to maybe incorporate them even more. Although I see that we have a very good link, but of course always we can always improve that. But so I see the COVID crisis as a test for the Nexus. I think that's important. I think we should all work together and to operationalize the Nexus, especially in this situation of crisis. And we are happy to do so, and to have a debate also from now on further. Thanks.
Thank you, Henriette. Abuka, Henriette just noted that she wants to strengthen engagement with local organizations. Any final remarks from your side on this and other issues that we discussed today?
I think what I want to say is that BMZ is already a strong partner to local agencies in Somalia, especially with the organization I work with, which is a local organization. And in the last 3-4 years, we have been able to manage huge projects with them, which are long-term and developmental in nature, about 4 to 5 years projects. And with the COVID response, I think this, as she said, these funds were quite flexible in responding to the immediate needs, as we even address these long-term challenges. That said, I think with the current emergency and the fact that local organizations have better reach as well as local perspective, it will be important to see how funding for these local organizations can be advanced, as well as provide some support in terms of capacity building. Thank you.
Thank you, Abuka. Ali, do you want to add?
Oh, I think it was a very comprehensive from Abubakar, and yeah, just one comment perhaps for BMZ, like looking at their partners, how they are doing. I would say they they try to localize their activities and try to ensure the participation, and then how they support the local initiative itself. Yeah, but I think there is still a need. I would appreciate in comparison the whole arrangement. But then in comparison to see the other funding agencies or I would say federal development departments, it's a great I think deal what BMZ is doing. So that's all from us. Yeah.
Thank you, Ali. I think these have been very beautiful closing remarks. I would like to thank you as our fantastic panel today. And also I would like to thank the very engaged audience for the interesting questions and discussions in the chat. But I don't want to relieve you into the Friday afternoon without giving you a hint on what is happening in the CHA meanwhile as well, because we have also an ongoing survey which is exactly tackling Nexus issues. So thank you for the panelists again, Howard, Abubakar, Ali, and Henrietta. It has been a pleasure. Please keep in touch with us. There's lots of interesting things going on in the chat as well. I mentioned our global online survey. You will find the link for the survey in the chat box. So if you're not participated already, please do so. And apart from that, I would like to also extend my thanks to the team at the CHA, who has been very supportive in the background. Thank you, Lena. Thank you, Arvid. Thank you, Ralph, and all the other people involved in this webinar. Thank you so much, and please stay tuned, follow us on Twitter, and if you have not already subscribed to our newsletter, that is another great idea. You will find the link to the subscription also in the chat box. The next one is coming next week, so I think that will be a good idea to also get the new issue. So yeah, thank you, everyone. It has been a pleasure. And herewith, goodbye.
Thank you, Darina. Bye-bye.
Thanks, everyone.
Bye-bye. Thanks.
Bye-bye. Thanks, Darina. Thanks, everyone. Bye-bye.